to all connect with one another. Also, this is going to be a really fantastic panel of some great experts we have in our communities. People drove in far in the rain to get here today. And we are really honored to have these guests as well as other regional council members here. So without further ado, I just want to welcome our guests and of course Attorney General Phil Weiser, who he himself has been traveling around the state, connecting with these folks, going to all portions of the state to make sure that their voices are heard. And today he's going to share and learn a little bit more about these best practices.
All right, well, we have both Bob McDonald and Dr. Ryan Jackman here to my left, and to my right we have Lesley Dahlkemper, Commissioner in Jefferson County, and Lori Laske, Commissioner in Alamosa County. Lori, I want to start with you, because one of the big questions that many are asking is, how do we ensure we get as many different voices together to help build the best plan possible, including not just public health experts, but those with lived experience? And I know you've done some really special work, so maybe you can talk about the general topic, but also specifically what you've done in the San Luis Valley.
Okay, well, thank you. Well, I'll start off with, our council is actually quite large. We have 46 people sitting on it. Of course, we have our voting members that are kind of put out there in the MOU. We did that. So out of our 6-county area, we do have a commissioner and a municipality from each of those, a public health person. We have someone from human services. We have law enforcement. But I think where we spent a lot of our work is going out and finding our stakeholder groups. Of course, we pulled in, we have somebody on the ambulance service. We have nurses. We have nurses in our correctional facilities. We have physicians. We have behavioral health, all of those. But what I think was really special to us is we have 4 people with lived experience and 2 families on our council. How did we do that? We did a couple of things. We did individual interviews. Me and different members of our council interviewed about 12 people in the community in different stages of recovery, and quite honestly, some not in recovery. And we asked them why. What are these hurdles that we are putting up? What are these roadblocks that you think are stopping them? We wanted to hear from them. So we did individual interviews. We have a good number of people on our council, and then we've also done a couple of forums. What we realized is, just like lifting the label, we needed to bring our community in and really have a better understanding of what we're looking at. So we had a forum, and then we broke out in separate groups. So we took 2 people with lived experience, put them in a group, made sure that they were comfortable, and I can tell you a lot of our people, they want to help, they want to share, and they want to share their stories. It was healing to them. I had so many of them come up afterwards that said, I needed to do this. But we put them in these small groups, and then we allowed the community, this was an open meeting. We also had all of our council members there, or a majority of them, ask them questions. Why this, why that? And the things that came out of that were just shocking. And it was a really rewarding experience. I have to tell you, I came into this position 2 ways. One, I have a family member. Would I say that I was lived experience? No, I was the phone call that said, Lori, I really messed up again. And I would go down. Unfortunately, this was my sister. We continued with that. She did recover. She was very, very successful as a drug and alcohol counselor, but she's also passed away. So for me, it's kind of living in that legacy. But if you would have said I was a lived experience person, I would say no. I opened up our county books and said, this opioid crisis is in every area. This comes through in my corner, the human resources. We need to do something about this. So these experiences of creating this council was really rewarding and really eye-opening even for me to do that. And so I think that is one of the things, is making sure that we hear from the people that we need to hear. We have a lot of experts, but right there I had a lived experienced person say, what you think you're doing isn't working. And that's how we did it.
So I've seen the work and the plan that's coming out of the Valley. It's very impressive, the substance of the product, but more impressive is what Lori just said, the process. I hope none of your lawyers have told you that you're limited on your respective regional councils to the required members. That is the floor, if you will. That is not the ceiling. I don't know if anyone's going to exceed your ceiling of 46 people and 4 with lived experience. I do commend to every single region here to talk to Lori and learn from what she's done. It is exemplary. Lesley, how have you guys approached it?
We approached it in a couple of different ways. Thanks so much, and it's good to be here with everyone this morning. One of the things that we did that might be a little bit unique is we pulled together a regional conference. Our regional council consists of 3 counties, and we're very diverse counties. You have Jefferson County, the 4th largest county in the state, which is geographically diverse, rural, suburban, urban. We have it all in Jeffco. And we also have Gilpin and Clear Creek counties. That's why that question about equity is so important to us, and how do we make sure we're strategic about investing those settlement dollars that we need to make decisions about. So we wanted to get as many voices in the room as possible, working with the Stedman Group, which is helping to facilitate this process moving forward. In June, we held an all-day conference to really get into the weeds about what is this work moving forward, what does it look like, how do our partners across all 3 counties want to be involved and engaged so they're constantly in the know and we're getting their best information moving forward. We level set the information that we presented during the conference. We had small group discussions threaded throughout the day, which included everything from share with us what the landscape looks like in your community, what's working, where are the gaps, so we could begin to do that inventory work. And then we also asked them how they wanted to be engaged, and most importantly, which voices are not at the table today. And there were lots of takeaways that came out of that conversation. And I think there were a lot of common themes across all 3 counties, but those voices included people with lived experience. In fact, we had a panel as well of 4 members of our community who talked about their lived experience or the impact on their lives. Allison, I know you were at the conference as well attending, and that really grounded us in our work. We talked a lot about families impacted by opioid use disorder, as well as emergency responders. Marginalized communities was a very important theme that we also heard, including LGBTQ, transgendered, unhoused, bilingual, diverse communities, making sure that we also have messengers from these different communities who have credibility as well. So that was another example of a way that we tackled this, and we may rival you in terms of our advisory committee and the number of folks that we're going to have, or what has been called the non-voting group. We're welcoming as many people to be a part of that, because we'd rather go slow in the beginning to make sure that we're all on the same page as we move forward with our 2-year plan.
Bob, I want to talk about how Denver's approaching it.
Sure. Well, I want to just call out, I'm not going to reiterate what some of my colleagues said, but we use some of the same strategies. But we are fortunate in Denver, I would say, that we are our own region. And so that affords us some opportunities where things might be a little bit streamlined with who we called together for this. So we have on our council all branches of government. We have city council members, we have members in the judicial system, of course, the executive branch. So we have all representatives in all branches of government. We have small providers, large providers. We have people with lived experience on our council. But I think one of the things that I want to reinforce is the importance of not just doing that stakeholder outreach and forming the council, but ongoing feedback, looking for opportunities where we can connect every day with people who are in this space, people who are struggling. So we took a lot of the strategies, again, that some of my colleagues mentioned, but we're also looking at opportunities within existing programs. So for example, we have something called the FAST program, which is in the Office of the Medical Examiner. Denver is unique from other health departments in that we are fortunate to have the Office of the Medical Examiner in the local public health department. And we have a team called the Family Advocate Support Team, who is a group of team members who actually engage on a daily basis with family members who've lost someone from the crisis that we're in. And so we're getting that ongoing feedback about how we're doing with our programming in existing programming, not just as a part of setting up the council. Another example is a program that we're very proud of. It's the Wellness Winnie program, very unique here in Denver. It's called the Wellness Winnie. It's a behavioral health mobile unit. We affectionately call it the Wellness Winnie because it's actually a Winnebago that we purchased and refurbished so that we could get out onto the street, my staff interacting with every day with people who are struggling. So we have that constant stream of feedback. We look for those opportunities and set them up the council, but we look for those day-to-day opportunities through existing programs. And I'll stop there. I know we have a number of other questions.
All right, Dr. Jackman.
So in Mesa County, I would say that ours probably mirrors Lesley's more, just in the sense that we are rural in nature. And we were able to capitalize on several programs that were already existing that had done a lot of the needs assessment work already, be that our Mesa County Opioid Response Group or our Rural Communities Opioids Response Grant that's NIDA funded, that's working in Mesa County and surrounding areas. So we had, prior to this announcement, a lot of information. And to, I think, just reinforce what has been said by this group as well as the groups that have come before, the outreach that went out to those who are already doing this work, who are already living in this area, was well heeded because of the existing work that had already happened. And people showed up, and people gave their lived experience, gave their treatment experience, and there was no cap set on the number of non-voting members that could come. And that has continued to be the case where, as we have met monthly as a governance committee, more people have showed up. As we've identified areas as a group that we want to look into, somebody on the committee knows somebody in our community who does that, and they're invited to the next committee meeting, and they bring and present, whether that's existing or other funding sources that are coming down, other efforts that are being made so that we don't duplicate work, we don't reinvent the wheel, and we're able to strengthen existing programs or identify a lack of a program in our community. And so I would echo what many people have said is the importance of heeding those people who are maybe the non-voting members and allowing them to educate those who are the voting members, and that's gone a long way in our community.
You averted something, Ryan, that I want to pick up on, which is you had existing information, existing programs. How have you approached the trade-off of investing more in existing programs versus how to think about starting and launching new programs?
Yeah, so this is something that we have had multiple debates on and discussions as our committee, and for that we involved everyone. We didn't involve just the voting members for saying what is needed. We did use facilitation from an outside group initially to help all of these voices be heard, and then strategically try to triage what can we do, and recognizing that this is an 18-year process, say what are the steps we want to take? Where do we need to strengthen our foundation so that 4, 6, 10, 18 years down the road, we're not just repeating the same thing we're doing now. And so in that discussion, we were able to highlight what are some areas that need to be strengthened that are existing. For example, in Mesa County, one of these areas that came out as a big area of focus was peers. We have peers within our community, but they are not necessarily being integrated in some of the key areas that they need to be, such as individuals being released from the Department of Corrections. That was a large area that we found we need to address. So we have existing programs that need to be strengthened, and we found ways that we might do that. In some ways that was strengthening programs we had, and in another case that was with our DA starting another program that will help to address some of this in our youth population. And as we've gone through this, and Mesa County is at a point now where we have already received our requests for proposals and are in the process of getting ready to vote on them in the next month as to who we will award the funds to. It's probably an even split of where we're starting some new programs and reinforcing existing programs. And I would say when it was a new program, what was the key to deciding whether we want to fund that or not was, where is the evidence that this is something that will be beneficial to our community? It's not just an idea that sounds good. We've asked specifically for what is the evidence, provide us the evidence, and how does that relate to Mesa County? And that has allowed us to feel much more comfortable going forward with some new programs that don't exist, as opposed to our existing programs that they can show it. They just say, we need this much more workforce to be able to reach the individuals you were saying you need to reach.
Lori, how have you approached that issue?
Oh, so, and I need to go back. There was people before I came into this. I was elected about 2 years ago that were working on it, but it was really the idea of bringing it together. So we actually created, it sounds simple, but it was a start. We did a spreadsheet and we did searches of all of the different services that were out there. Then we sat around on a Zoom meeting. I say sit around on a Zoom meeting, and we went through it line by line. And I asked the people in my community who know and who work in this every single day, is this still operating? Do we still have this funding? Is it operating like this? What are these different elements? And what we found is that a lot of times, for example, communities that care, we no longer have that grant in our region. We had it out there, it's listed on web pages, but it was not operating. So we kind of went through and did that to sort out where the gaps were and where we really needed to focus in the short term. You know, we are all doing the 2-year plan, and my council's idea with this is, what can we do that can really make an impact in this first 2 years? We have long-range goals too. We're looking at a treatment center, but we're not going to get that built and set up and the workforce in the first 2 years. So we're focusing on ours kind of 3 different areas. We have 21% of our plan going into prevention and education, and then the remaining 71% is in our treatment and recovery, and we're looking at peer groups because, again, that came out to be something. Supposedly we have them, but nobody knows where they're at, and they're obviously not operating the way they should. So we felt that, in fact, it was kind of interesting in the report. Do we say, is this an existing program or a new program? Because what I'm hearing on the streets is it's non-existent. Yeah, we say that we might have it. So that is an area that we're focusing in. We also had a big emphasis on recovery housing. We had no official recovery housing in our area. We had a house, but it wasn't certified. It wasn't CAR certified. It probably wasn't adequate to what we're doing. So that was another gap that we had. So we, as you say, whether they're new projects or existing projects, that's kind of a gray area, but there are things that need to be done. So that's where we're working at it, and that's kind of the process that we went. And I'll tell you in 2 years how that worked out is we're evaluating, because I think I want to share with everybody as we're going through this, it really is a process and it's learning. And if I ever come off as I know what's going on, that's not true. I'm learning along with this, and I appreciate the support of the office and everybody else out there. I'm going to be checking in on that dashboard that AG Weiser mentioned and seeing what other people are doing, because we're all kind of in the same boat, even though we have our own individual regional items to it. We're still all in this together. So sorry, very long question.
No, that's a great answer.
Next time I'm quick. I'll go back
that's a
to
great
yes
answer,
or no.
and I will say I hadn't thought about the in-between category of a pre-existing program that's no longer operating as another worthy investment. Lesley?
We're early on in the process, so I think for me, this really underscores the importance of the members who are on our advisory committee, those who are the subject matter expertise, those with lived experience, those who represent marginalized communities. And we'll go through an inventory process. But I also think this is such an important conversation. I think your point about where's the evidence, And I think that may end up having resulting in some tough conversations with folks who may believe in a program and that program is making a difference. And we need to really dig into that and be clear about how we're measuring effectiveness. What does that look like? And how might that vary from stakeholder to stakeholder? And how do we factor that in to the decisions that we're ultimately going to make about what we fund and how we fund it? And that's why I think a big part of this is the process. Wendy, you talked about that a little bit earlier this morning, and making sure that we're very thoughtful and strategic about the process we put forward. Sometimes people hear process and they say, oh, it's going to take forever. It's going to take a long time. I don't think that's necessarily so. I just think we need to be strategic and collaborative about how we move the work forward. We've got some good information in Jeffco about our challenges like lack of peer support programs, the need for high-intensity residential treatment, and also geographic inequities within Jefferson County. For example, if you live in Evergreen or Evergreen or Conifer, both of which are in my district, in District 3, it can take you up to 1 hour to travel each way for treatment. We've got to fix that. We've got to address that. So those are just a few of the issues we'll be tackling.
You have touched on this, Lesley, and Lori addressed it specifically. It was going to be my next question, but let me follow up. What's been your process for that inventory? Lori referred to a spreadsheet where they took all the programs that they knew were operating, then they researched, are they still operating? What's the status? Are you doing something similar in Jefferson County?
Yes, we will. What we will do is we will be pulling together our advisory committee and really delving deep into these issues with them to help us fill out resource inventories, really taking a look at strengths, weaknesses. We have an exercise we'll walk through with the Stedman group, and that will really help guide the generation and the prioritization of the program ideas and future steps in the process. The people that are doing this work across the 3-county region, again, our advisory committee, are the closest to these issues. And so they're going to be an important part of this work as we move forward. And in fact, I believe we've got 3-day-long or nearly 3-quarter-day meetings coming up to really dive in with our council and with our advisory committee moving forward.
So Bob, we have 2 questions on the table for you. First question, existing programs versus new programs. Second, related question, obviously, and if you answer in either order, how do you do the evaluation of what you have currently and what might be missing?
Yeah, I love both of these questions. I was hoping I'd get a chance to respond. So the first question about kind of the inventory, if you will, of services that are available. I think we all know that in the space of behavioral health, there are never enough resources, right? So we need to be very careful and thoughtful about how we use existing resources. We don't need to reinvent the wheel with everything, but we do need to have a good understanding of what resources are out there. So along those lines, we just finished contracting a third party to come in and do a behavioral health needs assessment for us. And from that, they were able to confirm a number of things that we thought were some of the contributing problems. Some are systemic long-term problems. There's a problem with Medicaid. There's a problem with Medicare. Those are difficult to navigate within. They also determined, like we all know, there aren't enough providers. They also determined another thing that we know confirmed that wait times are very long. The good news is that if you address one of those, you can address many others. And so in our plan, we are working towards building out a broader network of providers. We know that there are a lot of community-based organizations who would do this work, who would do behavioral health work, but they can't get reimbursed. They don't have the infrastructure within their organizations to navigate through Medicare and Medicaid. So we are looking at taking a variety of funding streams and doing a couple of things with those. One is to reimburse them directly from some of our funds. The other approach, again, is longer term, and that is to give them the money that they need to build the team within their existing organizations to help people navigate through Medicare and Medicaid. When you do that, okay, then you're building out more providers. In doing that, you reduce wait times, right? So a lot of the strategies kind of build upon each other. And A.G. Weiser, can you remind me what the second question was, please?
Well, I'm going to do a follow-up first, because I think you touched on a point that we want to probably follow up on, which is ensuring that we're creating the ability to leverage Medicaid and Medicare funding. And as a smart investment, to the extent we're leaving that funding base, let's say, untapped, that is a missed opportunity. So say a word or two more about that, and then it sounds like Ryan wants to jump on that point as well.
Yeah, so anybody who's worked in this space of Medicare and Medicaid know that there's some challenges there. Just the people that we're trying to serve the most, the people who need it the most, have the most difficulty with filling out the paperwork, understanding how Medicaid, and Medicare works, even knowing whether or not they are eligible for it. And it's very difficult to access someone who can help them navigate through that. That's what we're trying to get at, is getting money into the hands of community-based providers, getting them the staffing they need who have that expertise to help those that can then register, and them getting registered as an organization that can be reimbursed. The other
To the equation.
Yes.
So for organizations providing care, you're asking, are you taking Medicaid or Medicare as a form of billing? And if you're not, can we help you? And then for individuals who are struggling with addiction, you have what you call a navigator, or someone who can help them make sure they get connected to Medicaid and Medicare.
Yeah, I think you said it more eloquently than I did, but that's exactly right. Helping smaller community-based providers be approved for Medicaid and Medicare reimbursement, and then helping individuals navigate the paperwork so that they can access those funds too. One other thing I just want to share, I wanted to make this point when we talk about using existing programs. There's a huge issue with education and stigma. We all know that. We need to leverage existing programs to get information out there. I've said this before, this is where we need to be. If I were to walk down the 16th Street Mall and show 100 people that green coffee logo that everybody sees, it's on, one of the largest coffee providers in the country. If I were to show 100 people that logo, I would suggest that 100 people would say, I know who that is, that's Starbucks, right? If I were to ask those same 100 people, do you know what number you can text to get connected with Colorado Crisis? Do you know what number you could just text talk and be connected with an organization that can provide services in over 200 languages? Most people would say, no, I don't know that. We need to be able to get to that point where people say, yeah, I know that 5-digit number as well as I know the Starbucks logo.
So we at the state level are looking at re-entry as a important moment, because obviously people who get medication-assisted treatment in a jail go into community, and if they don't have a handoff, that can be a huge missed opportunity. One of the challenges is while they're in jail, they're not eligible for Medicaid. When they leave, they are. And so there might be some learnings we could follow from you, Bob, on that. Bob, the second question was the new programs versus existing programs. This Medicaid investment sounds like it's a new thing you're doing, so that's a new. How are you thinking about that trade-off?
Yeah, another great question. We all know that we're in a crisis. We can't wait for those types of system changes, okay? So we are, again, looking for low-hanging fruit, if you will, increased education about what is available currently right now. Going back to the point I just made, nobody knows that there is a 5-digit number you can text to get immediate help. Or people think that you have to pay for that to be connected. You have to pay for that. And people think, well, I can't pay, so I'm not going to text it, right? Or I'm going to get billed for that. So there are a lot of behavioral health services that are free. In fact, we thought about running a campaign that something along the lines of, what can you still get for free in this economy? So don't take that idea. But something along the lines of this very thing. You can still get crisis help if you need it. So we're looking at what are the low-hanging fruit, education, letting people know that resources are available, long-term systems, changing Medicare and Medicaid. We know somebody, I believe Lori or one of my other colleagues made this comment. This funding, we have opportunities now in the next 5 years with ARPA, another large grant called CDC Infrastructure Grant. Those grants are going away in 5 years. So we need to look for immediate things right now, but set the stage so that people can carry on with this work after those funding streams go away.
Ryan, I'm going to let you take this first, then I'll go back to Lori. The question about evaluating what's working and how to pivot based on what is working, what's not working. Have you started thinking about how you can approach that in Mesa County?
I mean, we are thinking about it, and it has been an important part of our evaluation process as we've asked people about how are you going to evaluate this program? What are the markers you're going to use to say that this is successful? And in our request for proposals, basically pointing out that the evidence and the sustainability and the measurements are things that need to be included in that application process so that we know how we're going to measure the success. I would say as a treatment provider on our governance committee, one of the areas that I have pushed for personally that I think has been well received is measuring success by access. One of the biggest issues that we face in Mesa County, as everywhere and has been highlighted, is a shortage of workforce, a limited number of resources, and that's something we need to build up. But the number of touches and the time frame in which that client receives that, particularly as we're talking about, to your point, of people leaving Department of Corrections programs, how quickly do they receive that contact as a measurement of our success? So big outcomes with a chronic condition that is chronically relapsing and remitting, like addiction, I don't think that negative urine drug tests or recovery are good markers, but access and the timing of that access are crucial to success, as there are limited windows for treatment.
Laura, you mentioned this before, how committed you are to evaluating what works, what doesn't. Ryan's raised an important point. It's not necessarily a fair metric, and you sound like you had this experience with your sister, to say staying clean versus not staying clean may not be a be-all, end-all judge of success. What are you thinking about as good markers of success?
Well, you said I could be very honest on this panel, and I'm going to be. This is a very tough question, and I'm not sure how I can answer it. I can tell you the way we're approaching it. We have subcommittees that have broken out in each of our 3 programs, and by the first part of October, our next full committee meeting, we're hoping that they'll bring back this information. I'm going to utilize what I heard on the previous panel today. I think some of the information that Nate mentioned is going to be something that we're looking at, but I don't have an exact answer for you. What I can say is we are very committed to utilizing these funds. And I'm very excited that with the office, when we submitted the plan, we had a number of discussions of what if we find out this isn't working? And they are allowing us to do some adjustments. So if it is not working and that is clear, by all means, we are not going to waste this money. We are going to pivot and do something that maybe with the more information, with a few tweaks, that will work. But I don't have an exact answer. All I can do is promise that we are going to do our best. And in 2 years when we come back, I hope I can put up a slide that says, this is how we evaluated and this is what we had. I also believe that this isn't something we can actually measure in 2 years. Success for people is long-term. What I can say is we're moving in the right direction and we're helping people. I know on my committee, the first committee meeting, they're like, well, CDPHE has this sense of how many people went to the emergency room, how many people had overdosed. And I said, we're not using an overdose and a death indicator as a level of success. We need to meet that beforehand. So we may have to create different criteria than using that. Granted, I am going to look at it on the backside and make sure those numbers are changing, but I don't want that to necessarily be the goal because we want to be more proactive.
You know, it seems to me, just building, Lori, on your comments, that another big part of the work that we have moving forward is helping to I don't know if manage expectations is quite the right way of framing it, but it really is about informing and working with our broader community so they're aware of the work that we're doing, the decisions we're making, why we're making those decisions, and where they engage along the way. Because I think all of us, first and foremost, want to use these dollars in a way that's going to make a difference in our community, whether it's saving lives, whether it's prevention, education, therapy, and more. So we want to be able to point to those results, but I think we also have to help educate our community around what do those results look like, and what can we expect, and how do we move this work forward in a way where everyone is engaged. And that strategic communications, I think, is going to be an important part of this, as well as community outreach and engagement.
So I'm going to let Bob answer that question, and Bob, I'll give you also the last question, which is in a way the question of the conference. How can we all learn from each other as different regions, and what devices, what practices will help that ongoing learning best go forward?
Yeah, if I may, I just want to add one thing to what my colleague said. I couldn't agree more. I think we have to measure a number of different metrics. As the doctor said, I think access to care is important, but I think within that space, quality of care and consistency of care. I have an extended family member, just as an example, who needs behavioral health services. 4 times in 1 year, she was able to access the care she needed, but with a different counselor every time. That's a problem, okay? So you could measure, well, was she able to access that care? Yes, but was it care that she was comfortable with, or does she have to rebuild those relationships, which is often the case with counseling? And so I would just suggest measuring a number of different metrics. Staying connected is very important. You know, in public health, we look for a number of opportunities, number of coalitions that we're in. The Denver Metro Partnership for Health is one of those. We are sharing our opioid abatement plans. They are sharing theirs with us. That's Jefferson, Arapahoe, Douglas County, Broomfield, Boulder County, even all the way up to Larimer County. I see my colleague here, Tom Gonzalez, director up there. You know, he joins those meetings, so we all stay connected. We plan on sharing our plans. Another one is the Colorado Alliance of Local Public Health Officials. That's a statewide a collaborative, of course, and we can share plans through that coalition as well. So we just need to look for those opportunities to stay connected, share ideas, and not reinvent the wheel. I think we don't have time for that.
Right?
That is the question, as you put it. And I think that regionally, we do well sharing what we're experiencing in counties that are alike one another. Coming from Western Colorado and with our rural communities opioid response grant, we do that. The question is, for all of us as we leave here, is can we maintain that, and is there the ability, for example, through the dashboard or other areas that I guess I would turn the question back to you as to how we can facilitate communication among unlike counties, because there will be things that come up for one county and ideas that may be able to be modified in other counties, whether that's rural to urban or urban to rural, but we all deal with very different settings. To your point of an hour being too long, I would love if my patients only had to travel an hour. So I think we're just so different and our environments are so different that I would turn that question to you.
So first, I'll turn it to all of you. Please let Heidi and Jamie know your thoughts on this. This is, for us, the critical role we want to help play as a facilitator and a convener. I like what you said, Ryan. There's a lot of informal networks among like communities, and I also like what Bob said. There's some formal networks among professionals. But let me turn to our county commissioners. How do we create some other networks among the leaders? And I think what's important, and let me just put this to both of you, we're going to have turnover too. And so part of the problem is going to be some of the local and county officials who may be playing a critical role today, in 2, 4, 6 years, that may be changing. So whatever practices we build need to be sustainable Have you seen in other contexts for communities of practice and learning ways to keep people connected?
I think because we have turnover in elected office, of course, we have term limits, we want to sustain that leadership throughout. And that's why I think it's important to have clarity on the front end and be willing to have those tough conversations and really dig in about what is our goal? What does success look like for us moving forward? And when we answer that question, are there common themes? Are there some disconnects? And let's dive into what those disconnects are so that when you have people who will continue on that advisory committee, who will continue on the regional council, they can continue to carry forward that work. And that we're not pushing aside concerns people may have, but instead we're embracing those conversations and we're talking regularly about it. And I see we're getting the 1 minute warning. So I'm going to go
last word to Lori.
Well, I was just going to say, I hope if you're an elected official, you are doing it because you love your community and you want to make it better. So whether you have that title or not, you should be helping and moving this forward. And I guess I foresee that in our region, I would hope. And if not, I got them on speed dial. I'm going to make a phone call.
And I'll say really quick, some of the most affected elected officials are also those elected officials who have moved on but continue to stay involved in their community. And we need that just as much.
Well, thank you all for being engaged. This has been a wonderful panel. Thank you.
Thank you, Attorney General, for being here for multiple panels. We're very fortunate. It's not often to get this much of his time. So you guys are special to him. Thank you, everyone. I think it's worth repeating. The infrastructure we create today is going to have impact on generations of Coloradans. So us sitting in this room have an enormous responsibility that we take this seriously beyond our roles as professionals, beyond our role as elected officials. We have a responsibility for generations for these settlement funds. We saw earlier, it's not just $400 million, potentially more like $500 million, and more settlements will be forthcoming. So I'm really happy to introduce our next speaker, who's here right beside me. You may have heard of her name already because she has been leading the efforts with the Behavioral Health Administration